Ibuprofen, the active ingredient in Advil Liqui-Gels Minis, is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, Nsaid, and works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking Advil Liqui-Gels Minis 200 mg Capsule Non-Steroidal Anti-Inflammatory, Nsaid, and salicylates, it's important to follow the directions on the product package if you're using the over-the-counter product. If your doctor has prescribed this medication, make sure to read the medication guide provided by your pharmacist before starting and each time you get a refill. If you have any questions, ask your doctor or pharmacist for guidance. Take this medication by mouth, usually every 4 to 6 hours with a full glass of water unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this drug. If you experience stomach upset, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. For ongoing conditions such as arthritis, continue taking this medication as directed by your doctor. For children, the dose is based on the child's weight. Make sure to read the package directions to find the proper dose for your child's weight, and consult the pharmacist or doctor if you have any questions or need help choosing a non-prescription product. For certain conditions, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. If you are taking this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you are using the non-prescription product to treat yourself or a child for fever or pain, consult the doctor right away if fever gets worse or lasts more than 3 days, or if pain worsens or lasts more than 10 days. Some common side effects of Advil Liqui-Gels Minis may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. It is important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, this medication may raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Serious side effects may include easy bruising/bleeding, changes in hearing, mental/mood changes, unexplained stiff neck, signs of kidney problems, changes in vision, symptoms of heart failure, or symptoms of liver damage. If you experience any of these serious side effects, it is important to seek medical attention immediately. While rare, a serious allergic reaction to this drug may occur. If you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, it is crucial to seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it is important to contact your doctor or pharmacist. If you experience any side effects, you should consult your healthcare provider for medical advice. Nonsteroidal anti-inflammatory drugs like Advil Liqui-Gels Minis may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important to avoid taking this drug right before or after heart bypass surgery. This medication may also rarely cause serious, rarely fatal, bleeding from the stomach or intestines, which can occur without warning. Older adults may be at higher risk for this effect. If you experience stomach pain that doesn't go away, black/tarry stools, or vomit that looks like coffee grounds, seek medical help right away. Other serious side effects to watch for include chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes. Be sure to talk to your doctor or pharmacist about the benefits and risks of taking Advil Liqui-Gels Minis, including the appropriate daily dosage and optimal timing for taking this medication. Before taking Advil Liqui-Gels Minis 200 mg Capsule Non-Steroidal Anti-Inflammatory, Nsaid, and salicylates, it's important to talk to your doctor or pharmacist if you have any allergies to ibuprofen, aspirin, or other NSAIDs. Additionally, be sure to discuss your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or throat/stomach/intestinal problems. It's also important to stay hydrated and talk to your doctor if you experience a change in the amount of urine, as kidney problems can occur with the use of NSAID medications. This medication may cause dizziness or drowsiness, so it's important to avoid driving or using machinery until you can do so safely. Limiting alcoholic beverages and avoiding tobacco use can also help reduce the risk of stomach bleeding. Additionally, this medication can make you more sensitive to the sun, so be sure to limit your time in the sun and use sunscreen and protective clothing when outdoors. For older adults, there may be a greater risk of stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Women of childbearing age should discuss the benefits and risks with their doctor, especially if they are pregnant or planning to become pregnant. It is not recommended for use in pregnancy from 20 weeks until delivery, and if used between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time. It's also important to consult with your doctor before breastfeeding while using this medication. Drug interactions can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and water pills, diuretics. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding. Examples include antiplatelet drugs and blood thinners. It's essential to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to ibuprofen and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. Daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke, so talk to your doctor about using a different medication to treat pain/fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. It's important to take the proper dosage of this medication and seek help if you or someone else has taken too much. If your doctor has recommended this medication for you, it's important not to share it with others. While you are taking this medication, your doctor may want to monitor your blood pressure and kidney function through lab and medical tests. It's important to keep all scheduled medical and lab appointments and consult your doctor for more information. If you are using this medication on a regular basis and you miss a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. It is important to take this medication at the same time each day for the best results. It's important to store Advil Liqui-Gels Minis 200 mg Capsule Non-Steroidal Anti-Inflammatory, Nsaid, and salicylates at room temperature, away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposing of the product, it's essential not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.